Welcome back to the show. This morning, new hope in preventing the leading cause of vision loss among older Americans. Age-related macular degeneration is a common eye disease for people over 60. And while there is no cure yet, there are treatments. And here now to explain is optometrist Dr. Gina Wesley. Welcome back, Dr. G.
Thank you, Corbin.
Okay, so give us an overview of what macular degeneration is. I hear this term all the time with seniors.
Yep, the most important thing to remember is the macula of your eye gives you your central straight ahead vision. So if you have a deterioration of this tissue, that's going to affect that central vision that we use every day, your color vision, and your depth perception. So it can have quite a devastating effect if people have that condition.
What does the macula do exactly?
Well, the macula has all the very fine discriminatory visual cells located in it. So it gives us so much information about that central straight ahead vision that we're utilizing every day to do most of our normal vision tasks. So if somebody has macular degeneration, they can have a deterioration in that vision that's enabling them to complete their normal everyday vision task. And for people who are otherwise very healthy, this can be quite a devastating and debilitating condition.
Now, you talk about this dry form and wet form of AMD. We've got some displays, if you will, here to show us. Tell us about the dry form first.
Now, the dry form is the most common form of macular degeneration, and as you see here, this picture is going in and it's showing you that shaded area right there, which is your macula.
Okay.
What happens is that there's a deposit and a breakdown of the tissue, and it's showing you here that 90% of macular degeneration is caused by the dry macular degeneration form. There's a breakdown in the tissue that's underlying right underneath the macula, where these deposits build up and then cause a deterioration of those visual cells. So then you start to see distortion and blurriness in your central straight ahead vision, as this demonstrates right here. So sometimes the changes are so subtle that patients won't know that they even have it until it can be quite progressive, which is why it's so important to get into your regular eye exam so that you know that this could be a possible visual problem for you.
And eventually this is what's going to happen. You get the spot that you can't see at all.
Exactly, exactly. So you can imagine what effect that has on your everyday vision.
Now, the other form of this is the wet form. This isn't found as often.
It's not found as often, but it is more severe in most cases. And what happens in that wet form of macular degeneration is that not only are there deposits in the macula, but there's a new growth of blood vessels that forms right under that tissue. And those new blood vessels can be very, very leaky. When they're leaky, they leak out fluid that can cause swelling of that macular tissue. So not only do you have the deposits like they're showing right there, but you've got those new blood vessels growing in. They're leaking out fluid and blood, and they're causing a swelling of the tissue that can further distort the vision even more so than the dry macular
Now, we've got some important ground to cover here before we're finished today, because we need to know the symptoms. What are we looking for? We're looking for blurriness.
Yes, and it's going to be gradual in some people, and I emphasize gradual. So some people may not even know, and one eye can be worse than the other.
Okay, and we're also looking at our nutrition, because there have been studies. I've got one here that with women over 40, 34% lower risk of developing this if they had certain vitamins in their diet.
Right. There's been a lot of information about nutrition and what role that can play in preventing or progressing the development of macular degeneration. Particularly, you know, the vitamin C, vitamin E, the lutein that you hear about with green leafy vegetables, the omega-3 fatty acids are also very good for the eyes.
Salmon.
Exactly.
Yeah.
So if you know you have family history or you have macular degeneration, the nutrition can play a big role.
Okay, and is it from 40 on? We need to come in every year and have this tested.
That's right.
That's the important thing, because you may not know that you're having this problem.
Exactly.
Thank you. So nice to see
you
you again. I should come in and get tested, although I am only 29. Okay, you can find out more about Dr. Gina Wesley by logging on to showcaseminnesota.com. Just click on the Tuesday link for this information.